I want to thank all of you who are participating today. We're going to hold questions, as Melissa said, to the end, just so I can get through the whole presentation, but I promise we'll get to them all. And since this is being recorded, I want to thank you if you're listening to the recording for listening at that time as well. So as Melissa said, I am a sex addiction, betrayal, trauma specialist in Boulder, Colorado. And so I run a center here, and we work with sex addiction, both with women addicts and men addicts. And we also work with partners. We work a lot with couples. So we also do workshops for women right now, for specifically for betrayal trauma. And so those are going to be expanded into a 3-day, I call them immersions. I work mainly somatically, and so since this is a complex, traumatic experience for the partner, we want to be looking at how we treat this a little bit differently than the conventional ways. So I've written 2 books. The first one is Letters to a Sex Addict, The Journey Through Grief and Betrayal. And the second one was co-authored by Dan Drake, who's in Los Angeles. And that book is Letters from a Sex Addict. They're both available on Amazon and Kindle. So the other thing I want to say is that if you are listening in on this webinar, I want to apologize for the pain that you're probably in. And I want to say that I've worked with, oh my gosh, hundreds of couples now over the last 10 years specializing in this. And there is recovery from this. It's hard work. I would say it is the worst addiction to be facing. And I have seen many, many people come out of this. So one of the areas of healing that I see least addressed when talking about sex addiction and betrayal trauma and infidelity is how the couple heals from sexual betrayal, both emotionally and sexually. And that's what we're focusing on today. So what I want to share with you is what I call the couple's developmental model. And this comes out of working with all the couples that I have. The model shows different stages to a couple healing from sex and porn addiction or from infidelity. I'm going to say that sex addicts can be men or women. The split that we've been seeing in the past has been 80% addicts, 20% partners, but this is rapidly changing. We're seeing more and more young women getting addicted to pornography. And so, so we're going to, well, one thing I wanted to say is that with addiction, I see very few male addicts or female addicts that are purely sex addicts. So women, I see a lot of sex covering love addiction. And also with the men, I say when we see sex addiction at the top, but consistently the underbelly is codependency and love addiction. So we really want to be looking at both of those and treating both of those. For simplicity today, I want permission to refer to the addict as him and the partner as her. Of course, keeping in mind that any gender can be addicted and any gender can experience betrayal trauma. So I want to show you this developmental model that I've developed. There we go. Okay. So we have 4 stages, and it starts from the bottom and works its way up. So this first stage is where, and I don't have a cursor. So, the first stage, if we look on the left-hand side, is the addict. And the addict, this is at discovery. And so the addict is swirling around in his own experience of 2 worlds suddenly colliding together. And the partner is spinning in her own chaos that the reality that she thought she had, she no longer has. And those arrows pointing to the addict basically say she is hypervigilant and keeping a very, very close eye and ear on everything that he's doing. The second stage is where he realizes that he has really caused deep pain and harm and a traumatic experience to his partner. And when this happens, both the addict and the partner get it. And we're going to talk about all of these stages in depth in just a minute, but I wanted to do the overview first. The next stage is where the two actually come together and the addiction becomes sort of this third entity. So the partner is no longer saying, you're the problem, you're the issue, you've done this to me. It's more of a, wow, this thing happened to both of us has stolen so much from both of us. The fourth stage is where, and I have to say, I rarely see couples get to this stage, but it happens. The fourth stage is where both are in solid recovery from what's happened. Trauma on both sides has been resolved. The triggers are way, way down. And something new organically comes into being. This could be that they both spontaneously say, hey, I think we should start a new business together. So it's not a dream that he had or a dream that she had. It's this newness, this new thing. Maybe they adopt a child. Maybe they start doing missionary work together. Maybe they start a counseling practice together. Maybe they move out of state. Maybe they move out of the country. But it's this new thing that they share. And I know when couples get to the stage that they really have put the past behind them as much as they can. It's still, I think, a shadow there, but that they have this brand new life and experience that they now are willing to enter into. So let's look a little bit closer at stage one. So a lot of couples at this stage, and this can be discovery, it can be when he reveals that something's wrong. Usually, unfortunately, when sex addiction is found out, it's the partner finds out. And what happens a lot at this stage is the addict is shocked that he actually has been found out and goes into a lot of denial or minimalization. It can go to blaming the partner. It's not, all of these pieces are really make it worse for the partner. At this stage, a lot of couples start having a lot of sex. So why, if someone has just been betrayed, would they be so quick to be intimate? And there's a lot of reasons for this. One is that the partner would like to feel close to her husband or her boyfriend or what have you. And so she might think that by being close sexually, that's going to give her the connection that she needs. It could be a competitive thing. Oh, you were with those other women. Let me show you how great I am. It could be that this is a very common one where she says, okay, if I just have more sex with him, then he won't be acting out. And I'm here to tell you that none of that is true. None of that is true. So the addict might be having a lot of sex with his partner and still be acting out sexually. The two have really nothing to do with each other. And this is, I think, a shock that comes to the partner. And sometimes it's a shock to the addict too. it can be very confusing. Wow, my partner is being sexually available and we're having more sex, but I'm still acting out with pornography, or I'm still seeking out prostitutes. And so that myth I just want to dispel right now. And what happens is that when the partner finds out about the sexual betrayal, her body goes into a traumatic state, because this is not something she chose. This is not something that she wanted. And so there's a couple of books that I recommend to both partners and addicts when they come in right away. And guess what? They're not about sex addiction. They're about trauma. And so one of them is called Waking the Tiger by Peter Levine. And the other one is The Body Bears the Burden by Bessel van der Kolk. I love when people read this, because now we're talking about what is happening traumatically and what is happening in her brain and body, and actually what has been happening in his brain and body that led him to the addiction in the first place. So, so a lot of things happen at this first stage for the partner. And her whole mind and body is going to be completely off. And she may experience depression, becoming enraged, definitely only focusing on what happened in the addiction. What happens in this place is that a lot of times she's asking a lot of questions and the addict is trying to answer. And what we want is a full therapeutic disclosure at this point. And so it's very, very challenging for the partner to wait for that. There's more evidence coming to do a disclosure sooner than later. And yet we want that addict to have as much insight and as much understanding of how he got here in the first place for her. So what we always want for the partner is we want to create safety for her. And this is a question that I get asked a lot. Well, how do we create safety? And this is pretty confusing. So what I want to do is I want to show you a slide here that I developed. This it says copyright 2020, but I pulled this slide together, I think in 2013, after working with partners for about 3 years. So a lot of times the addict has a certain desire and the therapist has a certain desire regarding the partner. And so you see these two graphs. And so the blue is the addict and the red is the partner. And so partners are incredibly competent. They're incredibly, I found them to be incredibly intelligent, capable. I have been looking for commonality amongst partners of sex addicts, and I've found two. And the one that I found that every partner agrees is that they're all overachievers in one way or another. Clients have said, "Hey, Wendy, I haven't had a career. I am a stay-at-home mom." And then I'll ask, "Well, how good of a stay-at-home mom are you?" And they say, "Oh my gosh, I'm the best stay-at-home mom ever. I do everything for my kids. I make sure, so it's like, well, there it is." So as he is spiraling down in his addiction, you can see that blue line going down. She is in red, as I said. She's keeping everything together. And a lot of times she's excusing behavior that seems odd to her. Like she might say, "Oh, he worked really late at the office, but he's such a hard worker and he works so hard for the family, so I understand." And then on discovery, the expectation she's going to have this little bit of a dip because she is so together. And that as he's pulling his, when he's getting sober and understanding the addiction and in recovery, that she also then will be there to support him and be there for him. this is what I've experienced as reality over and over and over again. As he's going down in his addiction, she is keeping everything together. At discovery, and when he gets into recovery, she starts a downward slide. And her bottom, as we refer to it, the lowest of her low, is significantly lower than his. And so as he's getting better, she's actually getting worse. And so this is incredibly upsetting for partners and for addicts. And with the couple, they want to get things sort of back on track as quickly as possible. I hear this all the time, can't we just get back on track? And what I say over and over again is this experience takes incredibly more time than you want or expect. And you need to be patient. And so a lot of times the addict will say, why? How long is this going to take? And I like to quip and say, well, how long have you been in your addiction? 10 years? 12 years? 15 years? Are you willing to give her half that time? It's only been a year, or it's only been 6 months. So a lot of patients, and the addict can do so much to help her heal from this, to help her with her triggers. And so some of the things that he can do are get involved in a 12-step meeting right away. There's SA, there's SAA, and I'm going to, I want to talk a little bit about check-ins and reporting in on addict recovery. So in 12-step jargon, there is a lot, there's a saying, well, you just stay on your side of the street and she stays on her side of the street, and your recovery is your recovery. And so you really don't have an obligation to share any of that. That is one of the worst things that the addict can do, is be going off to meetings and not be sharing what is happening for him. So you go to a meeting and you hear what other people are saying and sharing, and that of course is confidential. Those meetings have got to be confidential and anonymous. However, you can come home and say, hey, the topic today was the 4th step around resentment. And what I realized is that I didn't think I had a lot of resentment, but actually I really do. And I want to really work on that with my therapist and my sponsor, because I'm realizing that that resentment is not good for me, it's not good for you, and it's not good for us. That kind of share is completely okay. You're not breaking any of the principles of the 12-step community. And it helps her a lot to try to understand how recovery is going for you. Okay, so let's take a look at this next slide. So this is phase 2 that we talked about. And this is where we want the addict to really be empathizing with the partner. And this is so important because the addict is managing their defense mechanisms and their own reactivity to the partner's experience. And let me tell you, the partner's experience is not pretty at all. She's going to be crying. She's going to be shut down. She's going to be rageful. She's going to be blaming. She's going to be shut down again. There's commonly suicidal ideation. There's a lot happening for her. So we're really asking him to start feeling his feelings. And I want to say that the partner usually gets very, very frustrated because she wants him to start, she wants him to start sharing his feelings with her. However, sex addiction is also an intimacy disorder. And ironically, where do you think addicts are going to start experiencing intimacy first? Any ideas? It is with other men in their 12-step meetings or in their sex addiction groups. And I know how upsetting or deflating this is for the partner. Unfortunately, the way this goes is that the partner is most likely the last for him to be vulnerable with, the last for him to take a risk with. At this stage, we still are looking at people not being sexual. We're looking for actually non-sexual intimacy, and I'm going to be sharing something with you about that later on. We usually at phase 1 ask for 90 days of sexual sobriety from the addict. So that's no masturbation, of course, no refraining from all activities, as we say, in his inner circle, and certainly no sexual behavior with the partner right now, and for at least 90 days. And what we're really asking her to do is really be checking in with her body. So to all the partners listening right now, your body will never lie to you, ever. And so your body is giving you all kinds of cues. And so what happens is at stage 1, and sometimes at stage 2, people will start being sexual, and it might feel okay. And then later on that evening or the next day, the partner all of a sudden is totally rejecting the addict. And it's a sort of ricochet effect that happens. And he gets really confused and frustrated. She gets really confused and frustrated. Imagine that you're out walking one day and a tiger, we don't have many, if people are listening in North America, we don't have many tigers in North America. So a tiger jumps out and rips your arm off, and you survive. But the next day, if you can even go out and take a walk, every rustle, every shadow that you see, you become hyper vigilant because, well, that could be the tiger again, right? So unfortunately, with sex addiction, the addict in the partner's midbrain becomes like that tiger. Unfortunately, the behaviors of the sex addiction has created the same experience as getting your arm ripped off or your heart ripped out. And you survive, sort of, kind of, you think so. But partners will say, wow, when he just walks into the room, my whole body gets escalated. I don't know why. The phone rings and it's him, and I have this reaction to run to answer it, and then I have the reaction to run away from it. What's happening? And so this pure survival mechanism has kicked in. What we know about trauma now is that unconsciously she has to experience safety in order for those defense mechanisms to unconsciously release. That's pretty powerful. So we definitely want the addict to learn how to empathize, and this is not an easy task. Addicts have been trained to rely only on themselves, and they have been trained to shut down their feelings. And those two things create or interact with the addiction. So now he has to relearn feeling his feelings and then noticing when his partner is having feelings and really leaning in to her and managing the intense shame that he has from creating the addiction in the first place. Okay, stage 3. As I said before, this is where both partners come together, and grieving is this, they're grieving the thing that stole from them. At this stage, both people are pretty emotionally connected because we've gotten through stage 2, or are maintaining, sorry about that, maintaining stage 2. So physical intimacy at this point, well, first of all, we know that there's going to be, there has been developed a lot of emotional intimacy. So some of you have heard about disclosure, some of you have heard about impact statements by the partner after disclosure, and some of you have heard about a letter of apology or recognition or a reconciliation by the addict. And so these processes are really, really nice in order to be able to complete stage 2 and go to this phase 3. We can start looking at longer hugs at this point. We can start looking at sensate focusing exercises. We can start experimenting with clothes-on cuddling. The partner is always leading. So we want the addict to, a lot of addicts are, how do I say, they're the ones that initiate, they're the ones that are asking for sex, hinting at sex, and we want that to really shift. We want the addict to be okay in his own body and be able to, if cuddling happens and he has an erection, to be able to either get up and say, hey, I feel aroused, I need to get up and move a little bit, but I am coming back, or breathe through it, slow down. Erections can happen and then they can just go away. It's all right. You don't have to act on them. This is new news for addicts a lot of the time. We can start experimenting as she's directing for what she might want. So maybe she might try having his hand on her breast. And then she might say, okay, that's enough, now take it off. So she is really working with her own nervous system to see what is tolerable. We don't want her pushing through, and we don't want her to be chastising herself if her body is saying, no, that I can't go there. So a lot of acceptance on her part and on his part. We're looking for both people to be monitoring and managing their nervous systems. So many times in this dynamic, excitement can be mistaken for fear. And we want to be able to understand the difference between the two. And that can be difficult. One of my teachers once said that to have really healthy, amazing sex, the head and the heart and the genitals all need to be online at the same time. This is Jack Rosenberg's work with Integrative Body Psychotherapy. Unfortunately, he's passed. But how do you do that? Right? How do you have all three of those body experiences happening at the same time? Okay. Before having actual sex, I want the couple to be asking and answering a lot of questions, and we're going to look at those questions in just a minute. I'm watching the time here. So, so stage 4, you would think that at stage 4, couples would be having great sex because that's the goal, right? And so the question that I ask all of my clients now is, why are you being sexual? So I'm going to date myself here. And back in the day when people referred to having sex, they used the term making love. And I think somewhere in the 90s that changed to having sex. And I don't know why. I don't know why that happened, but I believe that it's significant. And so, are you sexual because you're trying to create connection? Are you sexual to please the other person because you think you should? And so, why? What's the sexuality about? Let's see here. I do want to say that I know that an addict is in full recovery when he says, Wendy, I am not caring or that driven anymore by sex. I am getting so much comfort and satisfaction by the way we touch each other, by the way we hold each other, by the conversations we're having, by the way we're able to look into each other's eyes, and I can see her and she can see me. These things are so beautiful, so beautiful. In a perfect world, I suppose, we really want to redo both the addicts and the partners' first sexual, romantic, love experiences to have a healthy, vulnerable, expressive experience that should have happened in the first place. But so many times those early experiences for both the addict and the partner really weren't that great. And certainly for the addict, there is shame linked in with sexuality somehow, and that also helped in creating the addiction. Quickly, I want to show you these. So we want to be, since we're connecting with our partners and ourselves, we don't want any mood-altering substances. And so we're asking questions about general touch, like, how do you like your hand to be held? When I massage your hand, how do you like that? Do you want that to be harder, softer, quicker, slower? What sort of touch do you like? Do you like oil or lotion or powder? Do you like to be in water? Do you like warm stones on your skin? So you see all these questions are dealing with sensuality, not so much sexuality. And for addicts, a lot of times we find that there has been a lot of touch deprivation, that there hasn't been a lot of cuddling or snuggling or in hugs or kisses from parents, caretakers. And so we really want to start having him being able to have that experience in non-sexually, and for her also to have that. So it's about 20 till, and I really want to take your questions. So sooner or later, this is going to go on my website, and you could see, I'm just going to kind of scroll down, there's sections, general touching, and then about kissing, music, words, talking about sexual touch for her, sexual touch for him. I didn't go into specific questions because I don't want to trigger addiction, or I don't want to trigger her betrayal trauma. And also we want to be talking eventually, of course, about other things like oral sex, intercourse, and really be the couple to be really vulnerable and saying what they like about that, what they don't like about that, if they like it, if they don't. And okay, I am going to stop the share and come back to you. And okay, so there's a lot of questions here. So one of the first questions is how to heal. Let's see, how to heal from, okay. Yeah. All right. Right. So, so with addiction can come in a lot of different forms. And so certainly with addiction, there can be a lot of aggression. There can be a lot of even having sex with someone when they're asleep. And so, well, a lot of times the partner doesn't even know that this is happening. And so any part of the sexual addiction for the partner can feel like rape. And so one of the questions is if my husband has raped me during the relationship, how do I work with, how do I heal from that? I think that it's very, very similar to healing from sexual abuse. And there's an amazing book, it's been around forever. It's called The Courage to Heal. And it doesn't have to do with sex addiction specifically, but it does have to do with being sexually abused. And there is a whole process of confronting any kind of protective mechanisms that the mind has created around that. So that's the very first stage, to say, oh my gosh, this really happened to me, and to have all your feelings around it. And then to decide what you need to do to be heard and seen around that. And I think also there is, whenever women have been sexually assaulted, sexually molested, that there needs to be work with their own shame around that. And there has to be also a reclamation of their own body and their own sexuality. I hope that answers that question. So this question is, does the physical abstinence recommendations apply for porn addiction only? I haven't felt a need to distance myself physically. Yes, the 90-day physical abstinence is, yes, the physical abstinence is going to be for the addict, whether porn or anything else, because with any kind of, okay, so this is a question that I'm asking all my clients now because I'm really, really curious about it. Do you think there's a difference? We have a hunter-gatherer brain, right? Hunter-gatherers, think of hunter-gatherers, right? Thousands of years ago. Do you think a hunter-gatherer brain can distinguish between real and virtual? And so if someone is only watching porn, I put in quotes, only watching porn, then the brain, I think, absorbs those images as if they were real. So we want his brain to get back to baseline. So women will say, well, Wendy, okay, he doesn't need to be, he's not being sexual for 90 days, but what about me? Can I masturbate? Can I pleasure? Yes, you can do whatever you want. The addict gets mad at this sometimes, but it's okay. All right. Another question. What about an open relationship when one partner is a love addict? Let's see. Whoops. Hang on. Okay. What about an open relationship when one partner is a love addict? When the partner of the letter says it's okay for their partner to sleep with others? Oh, yes. Great question. So many times a sex addict and a love addict find each other. It's the most amazing thing, right? They find each other. And I really believe that both people in a relationship have the same traumatic injuries, and they resolve those injuries in different ways. So one might become a sex addict and the other one might become, overly accommodating, overly wanting to please somebody. Not necessarily, but it can go that way. So, it's challenging because there's lots and lots of types of sexuality, and polyamory is one of them. And so I think each couple has to really say, each person has to say, am I okay, if my partner goes and, has sex with other people or not? And they have to be brutally, brutally honest with themselves around that, and then watch their behaviors when that starts happening. So they might say, yeah, no, I'm okay with it. And they start drinking more alcohol, or they start eating more chocolate, or they start becoming depressed. And so you really, for yourself, need to know how somatically your body is reacting when someone is going outside the relationship. I hope that answers that. Okay. Man, there's a lot of questions. Okay. Let's see. It's good. This is good. My partner has a porn addiction. My mental health has been declining since I found out. Yes, it will, which is in line with your examples. Yes. He has also experienced ED and an overall lack of intimacy. Yeah, for roughly a year and a half. Yep. I don't want to give him an ultimatum, but how do I make myself clear that if I can't do this, that I can't do this forever, then he's to see recovery. He's minimalizing, trying to do it alone. Yes. 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 So many men many men get erectile dysfunction when they're watching a lot of pornography. So they can masturbate to the virtual images, but then when they're with a real woman, they can't perform. They can't be sexual. And so, and a lot of men don't see the connection. They can't understand why one would link to the other. And a lot of times the partner is blamed for the erectile dysfunction, because they're saying, well, I can, get aroused this way, but how come I can't get aroused that way? Oh, wife, girlfriend, it must be your fault. It's not. So to this person, I would say a hard line that is not a threat, but it can sound something like this. Listen, I realize that you don't believe that the porn has to do with our sexual life and our emotional relationship. If you can't seek treatment for this, then I need to, and whatever you're going to do, I need to move out. I need to look at legal separation. I need to really protect myself. And so with the stages of grief, this would be like an acceptance level. There can be a lot of anger, of course, a lot of sadness, but it's this, here's where we're at. And notice my tone of voice. It's very calm. It's very steady. I'm being solid in what I'm believing and communicating. Okay, next question. How do you pendulate between the addict and early recovery saying, I'm doing so well, and she doesn't even acknowledge that? And the S&on who says, are you kidding me? I stayed in. Yeah. And I stayed in, and now you need to be with me, understand me, etc. How do you pendulate between the addict? Yeah. Okay. So the partner can say, well, how it usually goes is the partner says, I don't give a darn how you're doing in recovery. You ripped my heart out. However, if there's a way that the partner can say, I see that you are in recovery now. And let me show you this slide from Wendy Conquest about what happens to the partner when the addict's in recovery. Let me show you this slide. And this is where I'm at. Okay, the next question. I've been separated from my partner for over 5 years and feel like I have a lot of things to heal personally. I'm still friends in contact with him. How can I help him now? I've been separated. Okay. This is challenging because I don't know if this person is the addict or the partner. If you're the addict and you want to help healing healing the partner, you can have as much introspection as you possibly can about why this came to be and how it was not her fault. It was not anything that she did, that you came into the relationship either sexually addicted or primed for sex addiction. That's how you can help. I don't think it's helpful to send links to different treatment programs or things like that. I think that can be quite demeaning to the partner. Okay, how do couples heal when recovery has had many slips in the process? Yeah. So slips are just devastating. They're just devastating. And I think that part of this process for the partner is really looking straight ahead at what's in front of you. And so I like people to document when slips happen and to be able to say, okay, he had a slip in January. Okay, now, okay, it's March. He had a slip in March. Okay. And for the executive functioning brain to say, all right, that's 2 slips in 3 months. Okay. Now, if you're writing down, he had a slip Monday, he had a slip Wednesday, he had a slip Friday, and there's so many different slips. As a clinician, if I have a client that is slipping that much, I have to say, you know what, individual and group is not enough for you. You need a higher level of care. And so we need to be looking at an intensive. We need to be looking at a residential treatment center. We need to be looking at something else because this isn't acceptable. So I'm saying that as a clinician. Okay. Let's see. Okay, so the question was, what is the other book besides The Body Bears the Burden? It's called Waking the Tiger by Peter Levine, Levine. What if you're recovering alcoholic? Let's see. What if what if your recovering alcoholic partner has been involved with the BDSM life and says he wants to stop but continues regardless? Could this be a lifestyle rather than an addiction? When we're looking at recovery from alcoholism, from any addiction, and there is other, shall we say, interesting behavior, I think we need to have we have to have a clinical eye on that. And so BDSM has a lot of variety to it. And so I have a ton of questions about how that's manifesting, when it's manifesting, how it's manifesting, how long it's been part of this person's life. Of course, you want to say, is the BDSM had a behavior or how do I want to say, the favored pattern, a recreation of anything from childhood or adolescence. And at the end of the day, if he says, this is who I am, there is that stepping back and saying to yourself, can I live with this or can I not? Because you can't change somebody else. You just can't. And so if this really is who this person is and they're not going to stop, then there's that letting go process and all the grief that comes with that. Okay. Next question. What about the issue of what kind of question should the partner ask about his betrayal? What about the issue of what kind of questions should the partner ask about his betrayal? I'm a little bit confused by this, but I think the question is when the partner is asking about the betrayal. So, if you look up full therapeutic disclosure, that is going to give you a lot of information on how a lot of certified sex addiction therapists are working with disclosure. The partner will be peppering the addict with questions. And what happens a lot is he gives a knee-jerk answer that isn't well thought out or complete, or it might even be not completely honest, because addiction happens in a state of dissociation. So, you got to do a full disclosure. And now more and more, as a clinician, I can't ask a client to do a polygraph. But boy, they are effective. The partner can ask the addict to do a polygraph, and they're effective, because sometimes things are sort of hidden in the unconscious. The brain is very, very careful about protecting an individual. How to work with sexual anorexia. Sexual anorexia is tricky. So a lot of times the addiction will arrest, and then that person will go into not being sexual at all. And so I think that that's definitely a call for individual therapy, and that person really understanding their own sexuality and how that has gotten shut down in the past. Shame usually is a big component of this. So individual therapy for that, I would definitely say. I came late, so maybe you answered this. So sorry. Can I ask, why are you gendering the addict as male? Right. So thank you. So at the very beginning, I did say that addicts can be male, female, doesn't matter. I did that just for the ease of the presentation. But certainly addiction doesn't have any specific gender at all. And I'll say again, we're definitely seeing more women, and definitely more women come in to be treated for sex addiction, porn addiction. Can you say more about people in a relationship having the same traumatic injuries to refer me to more reading or resources on this? Yes. Let's see. I'm trying to think of my graduate work around this. This is when I first came across this information, and I think Harville Hendricks, who was one of the premier relationship therapists, alluded to this or was talking about this. I'm also thinking of Murray Bowen, who is a psychotherapist that practiced way back when. It's not a new concept. Children of sex addicts, especially teenagers, what should the essay disclose? Children of sex addicts. Okay, good. Okay, thank you for this question. So a lot of times people want to, especially the partner wants the addict to disclose to everybody, and because she wants to be validated in her pain. And so disclosure to teenagers is really, really tricky because teenagers have their own world going on. They have their own experience going on. And so a lot of times they don't want to be burdened by what's going on. But if they're in the house, they know something's wrong. And so what I like a lot is for the addict to go to their teenager and say, you know that there's been a lot of tension between your mom and I, or switching the gender now. If the woman's a sex addict, you know that there's been a lot of tension with your dad and I. And I've realized that I have an addiction. And I'm doing a lot of work. I'm doing a lot of learning. And stop. The teenager will either say, okay, thanks mom, thanks dad, okay, good, glad you're doing well. Or if they have a question, they'll ask a question. But we just want to let them know kind of what's going on, and that's about it. I've known about his addiction for years. I had no idea about the problems it would cause. We didn't have intimacy, but we had sex. Yes. I recently gave life to indications that he has had multiple affairs, but I can't prove it. This is what is making me crazy. Yes. I need his confession, but he says he has never been unfaithful. He is in recovery and is doing great, over a year sober. He even passed a polygraph. But I'm stuck on these indications. What do you recommend for the partner who's addict? Okay. So this is tricky because a lot of times the partner will have a feeling, right? Like, I really, really believe that he's had multiple affairs. And so it's tricky because emotional affairs can feel like actual affairs. Sometimes addicts will get, involved with someone right up to the point of having sex and then not. So there's all these energetics around sexuality or attention going to somebody else. And it feels so much like, I know it. And then the polygraph will say, yeah, he didn't do it. I would suggest, so there's very few, and they're called polygraphers, which it's not the best word. There's very few polygraphers that I will use in my area. And so my thought is that you interview the person that's doing the polygraph to make sure that they really are adept at doing polygraphs, because you want someone that really is able to do this well and be able to really go. So the way that my polygrapher works is that she goes through the entire disclosure plus the partner's questions and then asks 2 specific questions. And she's amazing. So anyway, all right. What should we be keeping in mind with having small children around in our recovery as a couple? What should we be keeping in mind with having small children around in our recovery as a couple? I'm not sure if this means like being careful about being sexual around the children. I think the biggest piece with small children is they're taking in absolutely everything that's happening. And so I think they are most affected by the addict and the partner distancing, that cold, chilly, I can't talk to you, I can't look at you feeling. They pick up on that. Not saying that you should fake that at all. I'm just saying they pick up on it. And they also pick up on aggression, on fights and arguments and name calling and that kind of thing. So I think that when you're around the kids, feeling out where you want to sit in the room, is it too intense to sit together? So the adults sitting together. So maybe you just, I often have meals rearranged at this time. So if you all sat down at the table and there's that intensity at the table, you know, maybe for a couple months you eat dinner watching TV, or, you know, you switch it up so that the kids aren't exposed to the intensity that's happened between the couple right at this time. Okay, let's see. I've been able to manage my lust addiction since being outed 3 months ago, but I still lie to my wife about making mistakes. Yes. So what could have been, yes, okay, sorry, I'm not reading this all. Sorry. I've been able to manage my lust addiction since being outed 3 months ago, but I still lie to my wife about making mistakes with insignificant things. So what could have been a 2-second conversation apology turns into hours and hours of arguments because I lied and then lied again to minimize the damage, etc. Then go into hysterics because I've been caught lying again. Yeah. So it's interesting because in that second book that I wrote, that I co-wrote with Dan Drake, there is a page on lying, and it goes, I can't believe I'm lying again. My wife asked me what I had for lunch, and I said a salad, and I actually had a steak. Like, why am I doing this? And so the addiction is the main piece that we want to be looking at, but underneath that are all these other behaviors, and one of them is lying. It's just chronic lying. And so the very first piece is to ask yourself why you're so afraid of being transparent with your wife. And you can do a little, start trying out little boundary statements like, I think this is going to make you angry, but I need to tell you anyway. Or I need to tell you something. Can you please promise not to get angry? And to start really being absolutely transparent. So I'm the addict, and it's been a messy recovery. We're still together, and I haven't acted out in 8 years. Yeah. My disclosure was done over 1.5 years in 3 separate times. Ooh. That has damaged my wife, maybe beyond repair. Right. Yes. So, unfortunately, we don't want disclosures to happen over a period of time because she says, okay, this is my new reality, and tries to adjust to that. And then another disclosure happens. And then it's, oh, now this is my new reality. She tries to adjust to that. And so we don't want what's called a leaky disclosure or a staggered disclosure. So for this person, I would say to really work with someone in your area, or work virtually with somebody who does a formal therapeutic disclosure, and do the whole disclosure. You do a lot of work putting it all together at one time. She gets to ask as many questions as she wants, and you once and for all do a full, total disclosure. You know, I feel badly that I didn't get to all the questions. I so appreciate people reaching out. I also have a Facebook page called Sex Addiction Counseling with Wendy Conquest. It's, of course, Facebook is worldwide. I've got over 1 million hits on it. I post things all the time there. You can also go to my webpage, wendyconquest.com, and sign up for my newsletter or any announcements that I've got. So however you want to interact, it's fine. I'm happy to help.